My name is Paul Bregman. I'm a medical doctor, a cannabis advocate, and also a cannabis patient. Cannabis is not something that can cure all or help everyone. And there's also a thing known as cannabis allergy. People who smoke cannabis or eat cannabis and stuff can be allergic to cannabis. It's a small percentage, but people should be aware of it. There's also a relatively new diagnosis that's being seen with the widespread use of cannabis. It's hyperemesis, meaning people will use the cannabis and the cannabis will produce nausea and vomiting that cannot be stopped, and that's a medical emergency, and people who have that condition should go to the emergency room because they could be vomiting up and become dehydrated, as well as perhaps tear their esophagus as well. Some people are relieved from this condition by taking hot showers, but it's a serious condition that people should be aware of. The most common side effect of cannabis, where people feel if they have to go to the emergency room or just take care of themselves, is the anxiety or the paranoia that's experienced when they're smoking too much cannabis or they're too sensitive to it. People with psychiatric disorders should be very careful using cannabis, as it can bring on psychosis and anxiety to those that are prone to that. There's also, from a book called Cannabis Pharmacy, a good outline that cannabis does interact with other medicines, such as barbiturates that people may be taking, such as an antibiotic with erythromycin. Whether it lowers the effectivity or decreases the effectivity of the THC and or the medicine, because everything you ingest goes into the liver. So this is with edible cannabis and the interaction with other drugs.